that have come together in order to ensure that we could have a panel like this where we could truly address the questions and concerns of our community. Thankful to KIPP New Jersey, Uncommon Schools, Great Oaks Legacy Charter School, Achieve Clinton Hill Charter School, and Marion P. Thomas. And so with that, I want to jump right in because I know people are anxious to get with their questions and get some real answers from our esteemed doctors. I'm going to just introduce you all really quickly because I know we want to jump in if that's okay. So we have Dr. Jubril, who is the director of Camden Coalition. Dr. Jubril, thank you so much for joining us. We have Dr. Karma, how are you? Who's a physician at University Hospital in the Trauma Center. And we have Dr. Chris, hi Dr. Chris, who's the Chief Health Equity Officer at University Hospital, and so much more that I think we're gonna be able to get into. And so with that, with the introduction of our panelists, I wanna jump in and I wanna start off with the vaccine trial because I think there are questions around that. Dr. Jubril, if I could kick off with you, what is the percentage of African-American and Latinx members between the age of 18 and 75 who participated in the vaccine trial?
Yeah, thanks so much, Chanel. And so happy to be here just to any opportunity to help get the word out. And so the goal today is going to be just to focus in on questions that you all might have, right? Particularly in this case, I'm going to focus on both the Pfizer and the Moderna trials, which are the sort of the two vaccines available to us. Well, I mean, there's supply issues right now, which we're all expectant will be, that the vaccine will be more available. But both of those studies are what I'm going to talk about. And in the Pfizer arm, so just to sort of to back up a bit, right? So about 20 plus million people as of last week have got the vaccine so far, right? Sometime last year, late last year, when the vaccine became available for a trial that was done, about 70,000 people, both in the Pfizer study, if you combine that with the Moderna study, about 70,000 plus people volunteered, right, to sort of see how effective is the vaccine. And you have about 40,000 plus in the Pfizer arm, and you have another 30,000 plus in the Moderna arm. And one of the questions I got, quite frankly, from like my family members was, well, are we in these trials? Are there enough people of color, Black, Latino, in the studies that was done? And so I dug in, I said, before answering any of these questions, let's sort of dig into the actual study itself, right? And what you'll find is that in the Pfizer arm, there was about 10% where people of color were specifically Black, and in the Moderna trial, it's 10+% as well, and particularly in the Moderna trial, there was about 20% that were Hispanic. So you see that and you go, okay, that's 10% of 40,000 people, right, under one arm, and another 10+% of 30,000 plus people. That's a good chunk. When you add that together, just Black people in the Pfizer study, there's about almost 3,500 plus. Which is a lot. So when we looked at the results, right, of when you heard numbers like, well, if you get the vaccine, it protects you by about 95% for the Pfizer study, and another like 93+% for the Moderna trial, right? Those same efficacy results were actually found in the subset that were Black and Hispanic. So we know that the same results in terms of efficacy and safety, it's actually the same for us as well. So just
yes, and thank you so much for giving that context, Dr. Justin. It's important that we have it. Dr. Chris, you were actually a part of the trial. Wondering if you can break down what does the vaccine itself contain, and please let us know if the Pfizer contains different things than the Moderna.
Excellent. So just to start, I lost my dad in this pandemic, and about the time that I lost my father, April 13th, I was seeing our hospital here, and Dr. Warren can testify of this as well. Nearly every patient in the hospital had coronavirus. I saw our Black and Brown communities devastated by this impact more broadly. So I needed a way to be a part of the solution, and I could hear my father's voice in my ear, follow the data, follow the science. My father was a research scientist. He started out cutting grass, never went to college, was self-taught, reading textbooks while working his second job at night, usually cleaning a building, and was able to ascend the research throne. So I felt really compelled to join the trial. So I joined the trial, and I, at that point, wanted to know as much as was possible to know. So my first injection was on August 31st. My second injection was on October 2nd. And what I knew about the trials at that point, I think it's pertinent to the answer of this. So the way that you make a decision like that, if you're a person in my shoes, I wanted to see what the early phases had shown, and was it safe? Would it be effective? And based off of what was known in August, late August, I decided to join. I was one of those 30,000 that Dr. Jubril described in the Moderna vaccine trial. But now we've had millions who have had Moderna and have had Pfizer. And I frequently hear from people, but doc, what are we putting in our bodies? So I'm going to talk about it in the most simple terms that I can. But in addition to that, I'll include links in the chat, and I would love for us to be able to share these links with everyone who's participating tonight. So think about both of these vaccines as recipes, right? I've heard people describe them different ways, and I'm going to borrow that term from Dr. Nyaku. Shout out to Dr. Nyaku, who also is here at University Hospital in Rutgers, New Jersey Medical School. So they're messenger RNA. Messenger RNA occurs naturally in your body. Messenger RNA helps your body to make proteins. Those proteins are a part of cell structure. Those proteins are a part of reactions, so they function as enzymes. So it helps your body function properly and effectively. So these particular vaccines were made in the lab to mirror the natural messenger RNA that occurs in your body. And these vaccines were a recipe for how to make a protein that occurs on the coronavirus. So if you think about the coronavirus being this fist that I have balled up here, and then if you saw crown spikes going all around my fist, those spikes are proteins. And so the vaccine is a recipe, a Snapchat message, that's another way to think about it, a genetic instruction sheet that tells your body to make a particular protein, a spike protein. And once your body makes that spike protein, you're not able to get infected. So the spike protein is in it, right? This messenger RNA makes a spike protein. You're not able to get infected because you're not being given coronavirus. You're being given instructions for a protein that's very similar to the protein that occurs in coronavirus. But in order for that messenger RNA to do the work that it's designed to do inside of your body, it has to be encoded in a fatty outer, I'm going to call it like a protective covering, because it keeps the messenger RNA together. Otherwise, the messenger RNA is unstable and it will degrade quickly and it won't do what you want it to do, right? So you have this lipid substance, this fatty coat on the outside of it. In addition to there being the fats, in addition to there being the messenger RNA, that's ribonucleic acid, if anyone wants to look that up, you're going to see what we call salts, right? Salts are things that also that help the messenger RNA not to be degraded, and some other things that fall in the category of sugars, all right? There are no eggs in this, and I say this in particular because certain vaccines are made, they're cultivated like in a chicken egg, so there are no eggs in it. I've been asked the question frequently.
Dr. Chris, there are no eggs in it, and is there pork in it?
No.
Okay, I asked that because, you know, there's been a recent
article. No, it's good. It's good. Yes, bring it out. And so when I say fat, and this is what I want people to understand, that coat, that lipid coat that holds the messenger RNA together, it has a very long name. It has in it polyethylene glycol, right? And so that is a part of what provides a cohesive structure to keep the messenger RNA molecule together. So messenger RNA, salts, sugars, and that fatty coat, that's very basic of what is in it. Let me also say what's not in it, because I've been asked this question a lot too. There isn't a chip in it, right? So there is not a chip in the vaccine. So just to sum it all up, you are given a genetic recipe, a genetic instruction sheet that gets injected into your arm, into your muscle, that goes into your cell with the help of this fatty coat on it, right? Because it keeps it together. Once it's in your cell, then your cell knows how to use messenger RNA instructions. It makes multiple copies of proteins. This protein is very similar to the protein that occurs on coronavirus, but you are not being given coronavirus, so you cannot get infected by the vaccine. Once your body makes all of these multiple copies of it, the messenger RNA instruction sheet gets degraded, right? That's why it's like a Snapchat message. It's here and then it's gone.
Dr. Chris, I wanna pause you there because I do have some specific questions that some of our audience members have. You're starting to get into what happens once the vaccine is there. Right. I wanna hold that real quick.
Okay.
And I just wanna go to Dr. Karma. Let's just put it out there. There are people of color in our audience, and they are concerned about taking the vaccine due to the unethical practices that we've seen historically and that we see now. What are how are you speaking to that audience that has this historical and present concern as we think about even transitioning into the vaccine?
Oh, I think that's a good question. I mean, first of all, I'm not sure about the unethical practices you're talking about today, but there were. I mean, obviously, we know about.
We think about like women who are pregnant, Black women who are pregnant, who are often sometimes they lose their lives. So I think there are some instances where people are concerned about trusting the healthcare institution.
Right.
And I would love for you to be able to address that.
I can definitely understand that. I mean, I work obviously at University Hospital. I work in the emergency department. So I do understand where the trust in the medical system derives from. I think we are also utilizing and putting in the forefront things that have kind of happened in the past too, from the Tuskegee experiment, which people don't really understand per se. They kind of just know that it has something to do with the syphilis, but basically what they did was they didn't treat our people who had syphilis, and which was a treatment was penicillin. So they didn't treat them. So that was years of generations that were affected by not being treated by syphilis. There was the physician, the father of gynecology, who was performing experiments on slave women, especially a young 17-year-old girl doing experiments, surgeries, and not giving anesthesia. So, I mean, knowing those type of things happened, stay forefront in our mind when we think about, is this something that's going to now affect me? Well, I'll tell you, because of those things that are happening or that happened, we have what we call the IRB. And part of the IRB's process, whether it's a local project research or governmental funded project research, is that things have to be done correctly. You have to first get consent from your patients to understand what they're doing, right? Mm-hmm. 2, you cannot just do any type of experiment any way that you want to do. It can't happen like that. And that was the reason for the IRB. We have it at University Hospital. Everybody has the IRB. And so I want people to be more, I guess, to feel more comfortable to know that you just can't do anything today. These vaccines were studied, were made sure that there were no negative effects on people. And it was made not just for us, all races that are taking it. And the people that were front in the line were the physicians. So, I mean, if you want to make sure that a vaccine is safe, look at who's taking it. And the people that are taking it are the ones that need to be here to take care of you. So if we're more confident and comfortable with taking the vaccine, I think people should at least look at that to be more comfortable for themselves.
Absolutely. I think I was reading a recent article that said, and Dr. Chris or Dr. Jubril, correct me if I'm wrong, that 13.7% of African Americans so far have taken the vaccine. Is that an accurate number?
Yeah.
No. What is the percentage now, Dr.?
No. So right now we actually have incomplete racial and ethnic data across everyone who has received the vaccine. What has been published today is a preliminary snapshot of that first month of those who were vaccinated. And roughly in that first month of those who were vaccinated, about 5.4% were Black. And if you look at Latino, about 11.5% were Latino in that first month. And we're extrapolating and then looking at data by state. So you see more and more data coming out by states. If we were able to say that, 13% of Blacks have been vaccinated, or 13% of the entire pool is Black, that would be progress, because we're not even there.
We're definitely not there.
We're nowhere near there.
It's so good that we're having this conversation, because there's so much misinformation out there. And so I'm happy that we're able to put it all on the forefront. Let's get into, and I think you've all touched on this in some way, the side effects of the vaccine. What are the side effects of the vaccine? Will people need to take a second shot of the vaccine? I'll offer it up to you, Dr. Jubril.
Yeah, so as far as the side effects from the vaccine, after your first, so there's 2 shots, right, for both the Pfizer and the Moderna, right? The Pfizer vaccine, you wait 3 weeks in between the first shot and the second one, and for the Moderna one, you wait about 4 weeks between the first and the second one. So after the first shot, people tend to have some soreness at the site there, some swelling, soreness, and maybe some warmth around there, right? It tends to be what we call a local reaction, right, after the first shot. Although some people, a smaller percentage, can have what we call a systemic reaction, which is where you could have a headache, some achiness, some body aches, right? But it's important to know the why, though, because the why is important. Because what's happening is what Dr. Chris mentioned, which is that this vaccine is a message to your immune cells to be able to identify the virus should your body become exposed to the virus.
Sure.
So what happens is when you're having this reaction, it's your immune cells essentially doing what we want them to do, which is they're trying to sort of think about your immune cells like an army, like a battalion, right? That's sort of, drumming up and getting ready to really learn, part of learning that what the virus looks like from the vaccine. Part of that learning is in making certain molecules in the body that sort of help make more immune cells and make more copies of your own natural immune cells. So when you're feeling that soreness in your arm or the body aches, right, it's really what we expect to happen. So you get that after, usually after the first shot, you get the local reaction. After the second shot, there's a higher likelihood to have this, what we call the systemic reaction, which is where you get more of the headache, the achiness. But again, that's for good reasons. It's your immune cells learning, doing what we want them to do, right? And that's really what we saw, in both the Pfizer and the Moderna trials. Now I want to take a moment to address this because there's things going around about well, is there a chance that later on down the line, how do we know that a year or 2 years from now that I'm not gonna grow a third leg or something like that, right?
And some people have even said, and I've seen, some articles floating around, could I die from taking the vaccine? So, tell me more about that. And other doctors, feel free to jump in.
Yeah, so on the question of that's actually a very important one. The question of can I die from getting the vaccine, right? And I actually want to take you back to the actual trial, which is, in the Pfizer trial, right? Remember there were 2 groups, right? About 17,000 people or so got the vaccine, and the same number got placebo, which is just like not the vaccine. They got placebo. And what we found was that in the group that got placebo, at the end of the trial, 2 people died. Now remember, they didn't get the vaccine, right? Mm-hmm. So after watching those people for 2 months, 2 people died, and in the arm that got the vaccine, 1 person died, right? But what we know though naturally is if you follow 40,000 people over 2 months, right, there are people who will naturally whose time is up, right? Who are gonna die?
They're gonna die.
So, right, exactly.
And we don't mean to smile when we say that, by the
No,
way.
but you know what? Let me just add that, Jubril. I mean, the problem is that people are having that causal effect, and you can't do it. I think when who died was recently, the baseball player.
Yes, Hank Aaron.
Hank Aaron, when he died, oh my God, everybody was like, he just had the vaccine, like, you know, the day before, a week before. And so they look at these articles, and you cannot have the direct effect. There has not been a direct effect from the vaccine to death at all. So I really want people to get that out their mind. And I knew that was going to be something people were really worried about, especially after seeing high-faced people have a reaction that they think is from the vaccine, but it's going to happen anyway, whether it's Bell's palsy, which is so very prominent. I mean, I can't even tell you how many Bell's palsy patients I see on a regular basis. It has nothing to do with the vaccine. It's like one of those, okay, well, you did get that. You did pass away. This happened, the Bell's palsy, the reactions. It is not specifically from the vaccine. And we have not
Dr.
shown
Chris,
any of that.
you said because we've been in a few discussions about this, you often break down that there are side effects and there are adverse effects, and there's a difference.
Totally different.
I wonder if you could just give some, because you actually participated in the trial, you experienced some of the side effects.
Definitely.
Can we just give just 1 minute of airtime today?
Definitely. Please, I would love to. So as I said before, I got my first injection August 31st. Okay, I want everyone to understand it's similar to, and I was on recently doing a similar session like this, and it was a family member of mine, and the family member said to me, oh, will this vaccine give you coronavirus like the flu vaccine gives you flu? And I said, neither of those things are true. So let me help everyone to understand it. The side effects that you experience, it's like when you go to the gym and your muscles get really sore and you think you've injured yourself, but you haven't injured yourself. Your muscles are just working. They're expanding and contracting, expanding and contracting. So your body is doing what it was designed to do. When you receive the vaccine, the side effects that you experience are normal and routine. I want everyone to understand this. A part of the trial, we learned the percentages, the actual percentages, and I have a slide that I could show anyone who wants to see it, what the percentages are. Most people got pain, soreness, or tenderness in their arm. Of those people, some additionally got swelling. I had pain in my arm. It felt like my flu vaccine, and it even felt like my tetanus, if any of you have had the tetanus on my second shot, okay? Most people experience, in addition to that pain, soreness, or swelling in their arm, which didn't prevent me from going to work, which didn't prevent me from doing my activities of daily living, and which didn't prevent me from lifting my hands, a lot of people experience headaches. So that was a generalized side effect. I got headaches. I got headaches for several days after the vaccine. In addition to that, people could have experienced fever or chills, but that was less frequently. People could have experienced body aches and soreness, but that was also less frequently. Okay, so I'm describing the ones that were more frequent and then the less frequent ones. The second injection, again, these side effects are normal and routine. They are to be expected. Doesn't mean every person will experience it. No, but it's within the normal range. Okay. So the second shot, think about your body is working even more. Your body is now becoming more expert at defending or protecting you against coronavirus should you be exposed to it. When I got the second shot, it felt different for me, my experience. And the reason why it felt different is because I got fatigue. I didn't get fatigue with the first shot. I just got headache. I got soreness in my arm, and I got a slight elevation in my temperature, but not a fever. With the second shot, I did get fatigue.
And Dr. Chris, just to clarify, when you were taking the second shot, was this during the trial or after the trial?
During the trial. I got both of my injections during the trial.
So will you, now that the trial is over, someone in our audience asked, how do I know I'm getting the vaccine or the placebo? Is that question still at play?
No, it's not at play.
Okay. All right,
it's not at play. So very good to check. So when I got my second injection, I got fatigue. When we say fatigue, it just means you're really tired. excessive severe tiredness. Okay. In addition to that, again, I got headaches. I got an even higher bump in my temperature, but never what we define as a fever, like just almost 100. But whenever I experienced those side effects, within 24 hours, they usually were all gone. A few lingered on further. So the tiredness and the fatigue that I experienced after the second injection, that was all gone. When I woke up the next day, I went about my business. I had to do a civilian task force meeting. I was sitting outside with my coat on cold for a couple of hours. So it didn't change my ability to function at my baseline.
Let me just add something to that, Chris. I had COVID. So I went into my vaccination series already having antibodies. Okay. So for me, first addressing your question, no, you can't do it because the clinical trials for that are over. So this is, we're now
they're no longer enrolling. I'm still in, it's not over, but they're no longer enrolling.
Okay. So
sorry, Dr. Karma, when you say no, you can't do it, you're specifically saying no, you can't do what?
The clinical trials, they're done.
Okay, got it.
So that was to her question. She was like, well, what do I know if I'm not getting the placebo?
Yeah.
There's no more placebo. This is the vaccine that we're giving to people now. And what Dr. Chris explained was her side effects. So, but for me, the way that she had her second side effect vaccines was part of my first. And the reason is because I already had antibodies. And so if I like to put it kind of plain and simple, your body, once you get the vaccine, your body is like, hey, this does not belong here. Get the crew. We're going to start up something and get ready for them. And that's how they start this antibody immune process. I already had an antibody. So once I already injected the first vaccine, my body said, hey, we know you. You're trying to get up in here. We're not going to let you do it. So
Dr. Karma, you can get COVID again if you've already had COVID. I'm saying, just to clarify, because there are still people out there to say, and my husband was one of them because he just left having COVID-19. I've already had it, so I can't get it again. And what you're verifying for us is you went to go take the vaccine because you can get COVID again.
Okay, so, but that wasn't what I was saying, but yes, you can get COVID again.
Got it.
It's very rare. People, they have shown that, the percentage of those, I think it was like 0.1% of those who have had the vaccine, who have had COVID have gotten it again. And I personally know some of my comrades who were positive in the spring of 2020 and then became positive again in the fall. So you can get it again, which is why I took the vaccine, right? Although I had antibodies, and we don't even know how long those antibodies last. We don't even know how good those antibodies are. And right about now, like the soft recommendation is 90 days because we kind of figure you don't get reinfected within 90 days. But after 90 days, hey, I don't know. Guess what?
And with the variants too,
again.
And with the variants.
That's right.
With the variants.
That's right.
So just to add something to what Dr. Warren is saying, because it's really important. So if you think about the vaccine is to protect you in most case scenarios and to give you the strongest or most effective protection that there is. The science on this is still emerging and is still building, but what the data to date is suggestive of is immunity that a person builds after vaccination is stronger than the immunity that a person has after a natural
immunity. Absolutely.
So Dr. Chris, you can still get COVID-19 after you've taken the vaccine, but you're less than likely to get it.
You could in very rare instances or scenarios, right? So rare. So those the two vaccines that are out to market right now under emergency use authorization are 94.1 and 95% effective, right? So there is a small percentage of people that it will not be very effective in, okay? What we also don't know definitively, but what the science is suggestive of, people who get the vaccine, it looks like it will reduce your ability to transmit coronavirus to someone else. Okay, so you could be an asymptomatic carrier, and the likelihood that you will transmit it to someone else while still present, the early data is suggestive that it's less. And the last thing that I will say, because this is spoken about a lot in the press, This is a RNA virus. It mutates, it changes, right? That's how it tries to survive and outsmart humans, outsmart the host, right? With those variants that are emerging, the big question is, do the vaccines that we currently have approved, do they cover against the variants? And this is very important to know. So what we know to date is that both the Moderna and Pfizer looks to have very good coverage around what's being called the UK strain. It also looks to have coverage around what's being called the South African strain, although that particular variant of the virus seems like it's able to escape some of the protection that the vaccination provides. That's why it's important for a person who's even had a coronavirus infection in the past to get vaccinated, because of variants. That's why it's always also important for you, once you're vaccinated, to wear your mask. Nothing is 100%. You're giving yourself the strongest and the best fighting chance.
And Dr.
Let me just say this, Chanel, what the vaccine does for those is to keep them from getting the severe illness or death. And
for how long though, Dr. Karma? How long does it last?
Well, currently the recommendation is obviously a one-time dosage of the two dose series, one time over the year. At that point, if we start to see the immunity, those who are immune going down, cases going up, we can always just do a booster, annual shot, just like we do the flu shot. I mean, it's not unheard of, but right now that's the only recommendation that's out there is one time.
Yes, understood. I want to switch a little bit, and I want to get into the topic of children fertility. Dr. Jubril, is it true the vaccine will impact fertility?
No, there's no evidence of that. And you know what Dr. Chris was saying earlier, and Dr. Warren about the fact that this is a messenger RNA, which is a message that's sent to our immune cells to naturally learn to fight the virus. That's all that's in it. In addition to, you know, to what Dr. Chris said about a capsule to carry the vaccine into the body, right? There isn't anything else to affect fertility, and that's a question I've got quite often. You know, here in my office, is as a person of, like, you know, child rearing age, right? Should I be worried? And the answer is no. There's no evidence of that.
You know where that came from, which is really funny, is that there were a few women. First, we all know that in clinical trials, they do not include pregnant women, but there were some women that did get pregnant during the trial, and I'm talking about the Pfizer trial, and they found that one person did lose their baby. Guess what? She did not receive the vaccine. She received the placebo. The ones that did get pregnant carried on their pregnancy, had no problems, and delivered healthy babies. So no, it is not.
Thank you so much for clarifying that. Even for me, Dr. Karma, because I got this little one right here, and I'm like, wait, can I take it?
Yes.
So I appreciate
plenty of friends who are pregnant, breastfeeding, that have taken it. So
yes.
It's an individual choice. You need to discuss it with your OB or your private physician. I say that very clearly, but I do know people who have taken it and done fine.
Now, when are kids eligible to take the vaccine, if ever?
Studies are going on right now.
Yes,
so when you have a vaccine come to market, and particularly if this is an adult vaccine, they will, scientists will progressively lower the age range to study younger and younger populations to see the safety and the efficacy or effectiveness in that pediatric or age group. So the next group that you're most likely going to see are those who are just younger than 16. So think about the 12-year-olds to about 12 to 16. It's that group first that they're evaluating to say, is this vaccine safe and effective in this age group? And they will progressively do that in a very deliberate, ethical, and sound fashion. Because the thing about a vaccine that's different about a drug or a therapeutic is that you have healthy people. And you have to prevent healthy people from developing worse. So you don't want to make healthy people sick. You don't want to harm or injure healthy people. So the level of protection, the level of safety that is built into the trials, I want to make sure everyone understands that it was very thorough, very thorough. And
Yeah, it
the
was.
process of doing investigations going forward will follow that same scientific scientific guidelines and robust ethical practices.
So maybe by the end of this year or at the beginning of
I think so.
2022, I would say that
Yeah.
you know, they might include now younger 12 to 16.
Okay, thank you so much for this. So, okay, I want to go with if I'm deciding to take it or I'm deciding not to. Questions on deciding to take it. What is the cost of getting the vaccine?
Free.
Free.
No money.
It's
It's
free.
free.
Okay, all right. And is
Right
it
now.
and again, to the audience, the goal of this is not to, you know, shame anyone or sway anyone. It's just to give you the facts so that you can make the decision that you need to make in order to do what's best for you and do what's best for your family. Someone asked in the audience, I think it was Umar, what are the efforts being taken to distribute the vaccine equitably? And what interventions are taking place to help streamline access for people who are disproportionately impacted by COVID-19?
Sure. I can talk about this and then open up the floor to anyone. Equity has to be at the center of everything we do in life and everything we do in healthcare, because if we don't, we allow the status quo to remain. And we all know that systemic racism, institutional racism impacts every facet and sector and aspect of life. And so what we're seeing, the same populations that were disproportionately devastated are also the populations that have received the vaccine at lower rates. Part of that has to do with access, right? And so what we're thinking through now in public health and what we're even thinking through at University Hospital is how do you remove those barriers? There are some barriers around convenience, meaning time that vaccination centers are open. Our vaccination centers open late into the evening. Our vaccination centers open over the weekend. Ultimately, we need to get to the point. If you look back in history, you even look at New York City as an example. If you want to vaccinate mass populations, you need almost 24/7 vaccination centers. We are not there yet. We're definitely not there. But that is one barrier, convenience. So time is an example of convenience. Transportation. Do people have access to get to where the vaccine is being offered? There are conversations being held around partnerships between ride agencies like Uber or Lyft partnering with pharmacies to ensure that persons, in particular senior citizens or others who live in transportation deserts and they don't have access to reliable public transportation, that think about rural environments, can get access to where the vaccines are being given. Another barrier that you want to think about is literacy and language. Is the information being given in a language that a person understands, and is it written in a way that's plain spoken that everyone can comprehend it, right? So I just mentioned several: convenience barriers, transportation barriers, language and literacy barriers. That's what's slowing down access to the vaccine across all of those groups. And that's where very specific actions targeted at those things that I mentioned have to be developed. Opening up centers that are close to where people live. So for instance, this is now why you're seeing the vaccine not just in hospitals or federally qualified health centers, but you're starting to see vaccines at pharmacies, right?
Yes,
it's just starting to pick up, and it's going to expand and expand.
CVS and Rite Aid.
Right, it'll be across the street from our hospital. You will begin to see vaccines, and this is just one example. There's a church in New Jersey that Governor Murphy spoke about through FEMA. They will have vaccines that will be available.
Baptist and Lincoln Gardens.
Increasingly, we need additional opportunities like that in community, because that's going to get at the access barriers.
Right.
Well, I'll say this too. I've been appointed to the Governor's Committee, Professional Advisory Committee for the COVID-19. And there are many of us that are part of the National Medical Association, which is the oldest organization for African-American physicians that are on there. And so we are very concerned and want to make sure that our community is part of the equation. I'm from Newark. I was raised in Newark. And so I want to make sure that my community is a part of who we are focusing on, not just for the COVID virus itself, but also for the virus. So we're making sure that things like the town halls, the videos that are being put out, those are targeting our community. And I think the fact that we're using pharmacies, that's a big thing. We just got to do more. The churches, we just got to make sure that we're utilizing those people and those sources who you trust, because we don't want you to not believe that this is a scheme against you or something aimed to make our community not do well. We got to get it. This has been a long-term thing, as we don't have trust, and so we got to start building it and believing that it's for our good.
Absolutely. Thank you so much to all the doctors here that are taking time to also address the audience questions. There is a question that keeps coming up that I want to make sure we spotlight, and this is, I'm deciding not to take the vaccine. I think that I can take vitamin C, I can take vitamin D, I can take zinc. Sambucol is a new one that I know I personally was giving my children every day once it came out, and I should be fine. Dr. Jubril, if you could kick us off, what are the pros and cons of going that route?
Yeah, I think that's a great question, right? And I am all about making sure your vitamin levels, especially vitamin D. As a society, we are vitamin D deficient, and that tends to affect a whole bunch of things, including your mood. Exercising, eating healthy, a lot of greens and veggies, absolutely, right? But that saying, prevention is better than cure, right? The goal of the vaccine is to prevent you from getting COVID, right? So there's two layers I like to think about. As a primary care physician, I want you to be healthy. I want your vitamin levels where they should be. I want you to exercise and eat healthy. And I want you to be vaccinated to prevent you from, to help your immune cells naturally learn to fight the infection, right? What I don't want, right, which is the opposite, which is that you catch COVID, right, without being protected, right? And I've seen people in the office who are young people, 30s, 40s, right, who survived the infection, but now they've got this chronic complication like blood clots in their legs. Now I've got 30, 40-year-olds who can't work because their leg swells up because they've caught COVID and they've developed a blood clot, right? And according to some data, to some studies, right, about some 1 in 6 people will have this long, complicated course, right, of like some sort of syndrome where their body isn't right. They're having palpitations. They're having unexplained acid reflux. They're having all these other complications. So my take is, I want myself, my family members, and you who's listening today, I want you protected from this. We want to prevent you from catching COVID. I don't think, if given the opportunity, I don't want to find out what happens to you if you catch COVID. I don't want you to be one of those that 1 in 6 that could develop a complication from it. And the tricky part is, we don't know who's in what group. We don't know whose immune cells are gonna sort of have this inflammatory response and just have all these other complications. So just think about the vaccine as this is prevention. This is on par with taking your vitamin D and exercising and eating healthy and getting vaccinated. That's how I want you to think about it.
Let me just add to, I had COVID and thank God I did all right. I'm here, but I'm telling you, even in the emergency department, we are now seeing the patients who did okay, who had minimal disease. They're coming back now with the long-term effects that Dr. Jubril talked about, and that is from lung disease, heart disease. I'm talking about the healthy 40-year-old who now has heart failure, to the lung disease, to depression, to skin diseases. They're having rashes, to chronic cough. I have a cough that just does not seem to go away. So yeah, you did fine. You had minimal disease. You came out of it okay. Guess what? The long-term effects is what we're now seeing. And because, again, this has only been, 9-10 months since we just started having this blow up. We don't know how long this is going to last. We don't know what's going to happen. My fear is that my prayer is that nobody gets this disease, because we are still trying to figure it out.
Yeah. Can I add a personal note to that?
Sure, go ahead.
I once heard a public health physician who I greatly admire and is a thought leader in equity, Dr. Cameron Jones, explain it this way: especially if you're a Black person or a person of color, we are at increased risk of exposure to coronavirus because of the jobs we work. Black and Latinos comprise about 43%, if you look at some US Census tract data, of the service and production industry, right? So we're at higher risk to be exposed, meaning we work in crowded, cramped scenarios, may not have access to PPE, may not have the best ventilation systems, right? So we had higher risk of exposure. Black and Latinos have higher risk of hospitalization. The CDC collected data, and as of the end of November, hospitalization rates were anywhere from 3 to 5 times higher in Black and Latinos. Not only do Black and Latinos have higher rates of hospitalization, we have higher rates of mortality. We die more from coronavirus. Dying more from coronavirus, if you control for age, we die anywhere from 2 times more to 2.7 times more if you include Native and Indigenous populations. And what Dr. Jubril was saying, if you don't die from coronavirus, you could have lingering effects. My sister, a breast cancer survivor, had her infection at this point 10 months ago. My sister has not returned to work. My sister was on supplemental oxygen. My sister still experiences very fast heart rate. My sister still experiences this sensation, like she describes it. And I've heard another person with coronavirus describe it. She was like, I can feel my lungs. I don't know how else to say it other than that. Like when I breathe in and I breathe out, she's like, I feel my lungs. And sometimes it feels like it's a very labored movement for me to breathe. There's no way for you to predict if you're going to be the person who gets coronavirus and has a very mild scenario, or if you get a mild scenario and have lingering effects, or if you get a very moderate, severe version of it and you got to be hospitalized and you have to go into the ICU, or if you're going to die from it.
I see it in the ER all the time.
Yes, you're in the ER. So to prevent that, you want to protect yourself as much as possible. All of those risks that I just described are higher, and they are especially higher if you're Black or brown than the risk associated with the vaccine. And I can't be more clear than that. I really need our community to understand that. And I saw a question that I want to answer because it's related to this. People are like, but you don't know the long-term effects. No, I don't know the long-term effects, but I can tell you what years of research and science will show you. If you're going to have an immune-mediated side effect of a side effect or adverse reaction of a vaccine, it's most likely to occur in the first 6 weeks to 2 months. Most likely. That's what years of research of all vaccines have shown us. That's why the FDA required 2 months of safety data, because in most cases, if there's going to be a worse or bad outcome, it's going to happen in that first 6 weeks to 2 months. You would not have been able to be approved by the FDA to get to an emergency use authorization if you showed very concerning, not side effects that happened that I described, chills, fevers, headaches, soreness, but concerning things happening in that window. Yes, we must continue to track people. I'm still in the trial. I'm not getting injections anymore, but they're still tracking me, okay? And they will track me for a total of 2 years because we want to ensure what right now the science is certain, not certain, near certain, that there are no long-term effects. No one knows that with any level of conclusive understanding, but we don't see anything to date in other messenger RNAs that have been studied in the lab. Right. We don't see anything others to date about vaccine science in general.
Dr. Chris, thank you so much for really bringing that home. As someone who just witnessed their husband go through COVID-19, he absolutely still has there are lasting impacts. He has trouble sometimes breathing, and he's a personal trainer. He's super fit. Yeah. And even now I'm seeing the impacts of it. So we appreciate all of you for your thoughts here. Doctors, if you can, while we switch over to bringing our parents on screen, if you can continue to just answer any of the questions that you see fit to answer, that would be great. But I want to transition to getting our parents who have volunteered graciously to join us. Tawana, Yvette, Officer Sabrina, if you could go on video for us now and unmute. I'd love to ask you, hi Yvette. Okay, there goes Sabrina, Officer Sabrina. And is Tawana here? Okay, I don't see, but we'll kick off. It's Tawana, if you're out there and you want to join us, please feel free to join us. Let me kick off with Officer Sabrina. What convinced you to take the vaccine?
Basically, I work for Newark Police Department for about 25 years now. I'll be retiring in a few months.
Thank you. Thank you for your service.
Oh, thank you. Thank you for yours, everyone on the panel. So I work in the office that actually we speak to everyone who has COVID, who's out medically. And we've had about 8 officers pass away, all of either Latino or African-American descent. And I spoke to a few of them, about 5. And everyone said, oh, we've taken precautions. As soon as they found out they had it, we have to speak to them and do an intake. Everyone said we tried to prevent it. We do everything right. I don't know how I contracted this. And then after they pass away, and I'm speaking to about 400 officers. I have an 11-year-old 11th grader at Great Oaks Legacy Charter School. I don't want to bring it home to him. He doesn't really go outside, and I work in close quarters with my coworkers. So I don't want to bring anything home to him. So if anything I can do to prevent from getting it myself, I'm going to do it for myself and for my family.
Right. Yeah. And just transitioning to you, Yvette, and I should mention Yvette from Uncommon Schools, Officer Sabrina is from Great Oaks Legacy. Yvette, have you experienced any side effects from the vaccine?
No, actually, it was funny because I was listening to a doctor speak, and one of my biggest things was that I actually had COVID when I was giving birth. I was 100%, I was home all day for the last 3 months because I didn't know when I was giving birth. And they were kind of like, okay, well, we got to swap you. And I'm so proud of myself. Like, yes, I've been quarantining. I haven't been anywhere. All I do is like go to the delivery guy and that's it. And I get swapped. And they're like, yeah, we're putting you in a separate room because you have COVID-19.
Oh,
so I'm giving birth.
That's like my nightmare.
Yeah, I'm shaking and I'm like losing my mind. Right. And I'm like, this can't be. And then my husband works at a hospital, so he's in and out. And then I didn't want to be like, well, I told you so, because he's dealing with patients and he's in and out. He was working in a construction site at that moment, like doing like medical. So he was all over the place. I'm home all day with our 3 kids and I'm pregnant. So I was like, you know what? I'm going to breathe. I'm going to get it together. And we went through that. It was, don't be scared. It was a horrible experience. But later on, I was talking to my doctor and I was kind of like, listen, would I be able to, contract it again? And I was like, my husband's like, yeah, you can. I was like, no, because I already have the antibodies. The doctor said the same thing that she was saying. She was like, listen, everyone thinks it's just a one-time deal. We don't really know the facts right now as far as like, how the antibodies are working or if it's going to be longer than 90 days. So it's either you deal with it as far as your husband coming in and out and you're at risk at all times, or you take the vaccine and you're trying to prevent it just work both ways as he got, so he got the vaccine and then it was a no-brainer for me. We have 3 kids and we just want to make sure that they're all safe and, everything is, good on this side.
Yes, absolutely. Thank you for sharing that. I think Tawana has just joined us. Tawana, interested to hear from you. Have you experienced any side effects after taking the vaccine?
No, the only side effects I experienced was soreness in my arm, and that was it.
Okay. All right. Understood. And we understand, audience, that this is not a one size fits all. Everyone is different, but we do appreciate our parents and family members coming to talk with us. Open question for all of you. Have your family members and friends followed your lead in getting the vaccine? If not, what are the conversations that you may or may not be having? Tawana, I'm going to kick off with you and then go up from there.
Okay, my dad and I, who are essential workers, we both were vaccinated. And my best friend, who's an essential worker, but my other friends, they're totally against it. I've been trying to get them to get vaccinated, as well as people on my job. I work for New York City Transit Authority. We lost over 200 people to the coronavirus, and we are still losing people to this day.
So sorry about that.
Me too. I am trying to get people on my job as well as my family and friends because I work with people of color. And it's very hard to convince us to take the vaccination when there are so much negative information out there. So it's hard to convince people on my job, even though you saw the death, we work with these people and they still won't get vaccinated. I get tested for coronavirus every week, even though I took the vaccination. I just got tested the other day and my test results are negative. So does my dad. And my dad had his second shot yesterday and I get my second dose on Sunday.
Okay. All right. Understood. And definitely let's keep the conversation going about how things are going with the second shot after you take it. I'd love to just make sure we can continue to share it with the audience. Yvette, can you also address that question? Have you talked with family and friends? Are they pro-vaccine or not? How's it going?
Well, my family, as far as my husband, myself, we're very pro. The rest of my family is not as open to it. And it's going back to all the stuff, all the factors that you were talking about, you know, like the disconnect between the medical fields and, you know, and our community, all the stuff that's on social media, all the memes, like people, they're a little freaked out about it. For us, like I said, it was a no-brainer. I'm breastfeeding right now, which was a big concern.
Yes.
So that was one of my biggest thing. And the doctor's kind of like, listen, you trust me, there's nothing bad can come from that. So that was like a big relief to us. And again, you know, it's a no-brainer. Like we feel like it's a safe thing to do for us and for others. I was actually asymptomatic when I came out positive the first time. So basically I was walking around everywhere with no symptoms and I could have infected everyone around me.
Wow.
So that was a big eye opener for me because I'm in the hospital around everyone. I've been around everyone in the hospital. And meanwhile, I'm like, yeah, I'm fine. You can swap me because I haven't been outside. Meanwhile, the whole time I was I was positive. And I had no symptoms whatsoever. I didn't have any cough. I didn't have any sore throat. I didn't have anything, no fever, nothing. So that's when I was kind of like, you know what? We have to get vaccinated because there's other people just like me that don't believe they have the virus. And guess what? They're spreading it around. So the best way to do it is just by getting vaccinated.
Yes. And then Officer Sabrina, what about you?
I received my second vaccination on Monday past.
Okay, recently.
Recently, yes.
Okay.
And the only thing is I still have a little soreness in my arm and that's all I've experienced. My department, we test every 10 days. So we have to test quite frequently. My family, basically, I'm the only one who received vaccination. They want to hold off and wait just a little bit longer, they said, but it is what it is.
Okay.
So
all right.
I'll be their test person that they see nothing happened to me and I'm fine and I'm well, so.
Okay. Keeping us on time, I wonder if we can just go a little over by maybe 5 minutes, open this up to everyone here. Once we leave this conversation, there may still be lingering questions, lingering concerns, other thoughts. Where can members of our audience turn to in order to continue to be appropriately educated about the vaccine so that they can make their informed decisions? Dr. Jubril, Dr. Jubril, I'll kick off with you and then go to Dr. Karma.
I think that's a great question. I think if you ask me what drives me to want to do this right in the community, it's really to have folks in the community hear from healthcare professionals who have studied the vaccine, who have the knowledge base to give an opinion on it. And I'm gonna draw a bit of an analogy, and I don't mean this in a condescending way at all, right? If I have a plumbing problem in my house, right, I'm not calling a mechanic. I'm not, I'm calling a plumber to get an opinion and then to hopefully fix the problem, right? Yeah. So, because there's a lot of stuff out there, on TikTok, there's challenges going on about, fun and games, but it's unfortunate that there's folks who rely on that information, right? So you want to get information from your primary care doctor or your healthcare provider. The CDC is a great source of information. COVID-19.nj.gov, in the state of Jersey, right, has a lot of
chat for us, right, Dr. Jubril?
Yes, we'll do. COVID-19.nj.gov. Most of the questions you're gonna have, some of these questions that we've answered today are in there as well. But I cannot overstate the fact that you want to get information from a trusted source, not WhatsApp messages, not Facebook messages, not TikTok, none of that.
Okay. All right. I love that analogy. Don't call the mechanic for plumbing. That's really good. Dr. Karma, I want you to take the question, but I noticed I had a few educators out there wondering where our educators can go in order to receive information about how they can get vaccinated should they decide to.
Dr. Jubril already said it, but the CDC website is like really a great source of wealth of information that people should go to, and it's actually true. And so I think Chris put something in there too. Dr. Jubril put something in the chat as well, so that you guys can have resources to get the information. I mean, the key is making sure that you're getting it from reliable sources, and on social media is not the best.
Right. And in addition to, just to add to that, so in addition to the CDC, that's a very good website to go to, the World Health Organization oftentimes has very health literate information around coronavirus and the vaccine. Hospitals, their websites usually point you to information around the vaccine, or academic medical centers, like where you have medical schools, places of higher learning. And I think it's very important that everyone understands that there are about 43% of Black people in a recent poll were in the wait and see category. Like, these are the people in the poll. 43% were in the wait and see category. And for me, I see the upside of that, because more Black people were in the wait and see than were in the definitely no.
I know you all know somebody. Oh, I'm gonna wait.
Yes,
I'm gonna get it,
right?
but I'm gonna wait
but I'm gonna wait.
Girlfriend,
right?
maybe like next year.
That helping people in that decision journey is providing them with the facts and the science that's on the CDC website. But if you've already been vaccinated, it's your experience. That's what we're learning. It's your experience of vaccination helps someone else in your circle, or someone who sees themselves in you. That's why you see Black physicians of color who have been vaccinated coming forth in the public to describe their experiences. That's why you see pastors coming forth in the public to describe their experiences. So if you have family members, or if you have friends, continue to share your experiences and to point them to others who have had the vaccine, who have had completed both doses or have completed one dose, and also highlight to them. And I want people to know this, because Black and brown people have been devastated by this pandemic, but we have also been a part of the solution.
Yes.
We have been a part of the solution. Yes. Not only have we participated in trials that got this nation to this point, but we were the scientists, Dr. Kizmikia Corbett, right? A Black woman, a young Black woman who works at the NIH and was on the team that helped Moderna design the vaccine that so many of us are receiving. That's information that I want our community to know.
Yeah.
Ms. Marshall asked a good question. She said a lot of the videos have physicians, nurses, and stuff that are saying some of the opposite information. Research who they are, because I saw a couple of those videos myself, and when I went onto the website to see if this nurse was even certified, she's not even on the list of nurses. She said she's an APN, not even on the list of nurses for that state. So see if you can really research who you're getting this information from, to make sure, yes, everybody says they're a doctor, everybody went to med school, everybody doesn't have the same type of feeling about it. And you can't change that. But like Dr. Chris said, talk to somebody who has. Talk to your friends, talk to some of the teachers and some of the parents who have, not teachers, but some of the parents who have been vaccinated, and see how they're doing.
Absolutely. That's a really good push, Dr. Karma. I think what our audience would probably love to see, and this is always my call to action after in hosting a panel anywhere, is that the people who brought this together are networks that brought this together. We do this again, and we bring some of the very same people back so that we can address questions that have come up later, because we know that there are more questions that will come. As the CEO of a social justice organization called Project Ready, the investment that I've made into figuring out and learning more about the vaccine is COVID-19 is disproportionately impacting our community in so many ways. Beyond whether or not you could get COVID-19, we're experiencing remote learning, we're experiencing a deepening digital divide, we're experiencing higher levels of unemployment. And so what I've dropped into the chat is a COVID-19 resource guide that we've compiled for any audience members that may be thinking about how they can approach some of the other impacts of COVID-19. And we also link to the website listed here so that you can get more information about the vaccine. I was not going to take the vaccine. I texted Dr. Chris at 10 p.m. one night and said, I'm not taking it. What do you say to that? And she spent hours talking to me about why it was important. And it was from that conversation that I started to open up. And as I continue to host panels like this, from here to different states, I am unanimously going to be taking the vaccine as soon as it is made available to me. I just want to name that. So with that, I thank all of our doctors, Dr. Jubril, Dr. Karma, Dr. Chris for joining us. I thank our parents for taking a moment, Officer Sabrina, Yvette, and Tawana. And again, I thank the networks for bringing this together.